Here we go. Hello, Valerie. Hello, Madeline. I really appreciate you taking a few minutes out of your now super busy days to kind of chat a little bit and let the other people who might see this kind of know a little bit about your history. We first met about 6, 8 months ago. Tell me what was going on. You're only 13 years old, I believe. What was going on with regard to your headaches and how was it impacting your life?
I do I start with the from the beginning?
Yeah, just like, when we first met, what was going on?
I had very severe zapping and throbbing in my head,
Mm-hmm.
and it caused a lot of sleep problems. It caused me to not being able to go to school and see my friends. It was it big impact in our life, and it made life very difficult. She couldn't even grow her hair out. We had to cut her hair really short.
Mm.
So,
Yeah, yeah.
so looking for a solution, we tried all the different medications you could try, anti-seizure meds, um, all the injections. We tried Botox, and sometimes the Botox would backfire on her.
Yeah,
So
because it
then
would sometimes make it worse, right?
I was looking for a different route, and even if it was what the doctors might say was unconventional, but to me, it's the only option that we had left.
Yeah. So ultimately, right. So ultimately, we met and we talked about what was going on. We figured out that even though you also had facial pain, a lot of that was caused secondarily by pain in the back of the head on your left side. And at the end of the day, we operated on 3 nerves in the back of the head. That was essentially 6 months ago. So here we are today. Madeline, how are things at this point?
I feel a lot better. I have more energy. I guess I'm able to sleep now. I can go to my friends. I can run around. I can go play, and I'm not as depressed as I was before.
Yeah. And overall, from your perspective and mom, your perspective, I mean, how is life different? Because it sounds like, as we were talking before this, you have relatively little pain. You still use the Botox, but at this point now it helps and it certainly doesn't make anything worse. And it sounds like when you have that Botox along with whatever the surgery did, you're kind of essentially almost pain free.
That's correct. She can actually do exercises now if she chooses to, whereas before she couldn't even walk down the sidewalk without throbbing kicking in. So a lot has changed. It's been very beneficial.
Okay. Well, guys, I really appreciate. I know this is sometimes a little awkward, seems a little funny, but I think your story highlights so many wonderful things and so many important points. I think the comment you made about this not being quote unquote conventional, I think that's still what a lot of people think. But hopefully, with more and more stories like yourself, this will become an option for people. It's certainly not something that everyone needs, but obviously, when more conventional therapies like medicines and injections and so forth fail, it's great to have another option, especially one that's this effective. I think it also highlights your story, highlights the fact that oftentimes the surgery can make existing medicines more effective. So before, Botox actually made you worse. Now, even though the surgery didn't give you 100% relief, it got pretty close. And then with the Botox, it's now helpful. And so that allows you to get to essentially 100% relief, which is really just so great to hear. And, I can see it in your face when we first met, Madeline. Your eyes were kind of like half asleep and you were very quiet. And I could just see in your face how more animated you are, how much energy you have, and it's obviously really heartwarming. It's kind of the reason we do this. So again, want to say thank you and best of luck to you in the future. Okay.
Thank you. We want to thank you guys for the help and for being there when we needed you guys.
Our pleasure.
Thanks.
Bye-bye.